We're all looking for solutions to this violence. We're looking for your help too. If you have solutions, suggestions, and want to come on the show and talk about it, we'll be happy to have you. So how do we end or slow down the gun violence in Philly?
And it's something that came up this time yesterday morning when we were interviewing members of City Council. We had them here, and we were talking about, well, what are they doing in other cities, or what's been done in the past that we can make work? And Councilwoman Helen Gim brought this up.
Do you know an example of a city where it's working?
There are a number of programs that are working. So there are things where, like a Cure Violence program. These are violence interrupter programs.
Cure violence.
Cure violence. And it looks at the problem as a disease and treating those at high risk. So in Philadelphia, the program launched in 2010 and saw a 30% reduction in shootings over a 3-year period in the 22nd district. So why is it not being implemented all over the city? If we know it works, how come we're not seeing it everywhere? So we have Marla Davis Bellamy, director of Philadelphia Ceasefire and Philly Hub, joining us now. And Philly Ceasefire, it falls under Cure Violence, a program that Councilwoman Gim mentioned.
Absolutely. Cure Violence is actually an international organization. It's called Cure Violence Global. And so there are many cities across the country, across the world, in fact, internationally, that are replicating this model that looks at violence as a public health issue. Yeah. So we are actually the first replication site in the state of Pennsylvania. We started this initiative in 2011. So it's been about 11 years now that we've been engaged in this work. We certainly received funding from the Department of Justice in terms of a partnership early on with the city of Philadelphia. And just most recently have received some funding from the state to implement the program in the 14th.
Oh, good, because like you said, you started this in 2011. What was Governor Rendell?
Absolutely.
So 2011. And then I guess some funding ran out and you had to end it after 2 or 3 years. Now you did this in, here's a map of the different Philadelphia police districts. The purple one here is the 22nd. Is that North Philly?
That's North Philly. That's where we first started.
And it seemed to work. And Alex said, you treat it like a disease, like COVID, get in there and attack it. Give me some examples of what you would do.
Absolutely. Well, what we do is we really, first and foremost, we identify what we call outreach workers and violence interrupters. These are individuals who've kind of lived that lifestyle, who are from the geographic area that we're serving. Because the goal is certainly to work with high-risk individuals, shooters, that are deeply engaged in high-risk activity. And what better way to do that than utilize people who have been similarly situated?
So kind of become a mentor. Do those people get paid?
Absolutely. Okay. Absolutely. In terms of our program, they are full-time employees of Temple University.
Why'd the funding run out? It was working in the 22nd, and then they just stopped it.
Well, it's a struggle. It's a struggle not just for us, but cities across the nation, because I think it's a little challenging for some folks to kind of think about violence as a public health issue. I think,
You would think it wouldn't be challenging here, though, considering how much that we're seeing and how many people are dying, right?
Well, we do, certainly have public health officials here locally that have been talking about it. But I think that we're at the point now where we should kind of explore other initiatives, other evidence-based programs that certainly are working across the country, including Cure Violence.
Okay, if I want to become a mentor for somebody that's at risk, who are these people? And they're going to get paid.
Absolutely.
Volunteers?
No, these are individuals who we know have certainly had a similar past experience. Some of them are returning citizens, but all of them, in terms of the geographic area that we're serving, come from that area. They grew up in that area. Therefore, they know the families. They know the people that are deeply engaged in violent activity. And when you talk about this whole notion of violence, when we go into schools and other places, young people are captivated when they hear them talk about their own personal experience, our outreach workers and violence interrupters, because it's similar to a worker or some sponsor who's kind of been there, done that. And so these outreach workers and violence interrupters are working one-on-one with these individuals. They're making 5 home visits a month, 3 telephone calls a week, with the idea of staying in their ear, helping them make better choices.
So they're a constant presence. It's not we're just going to come in, handle this situation, and then be out.
Absolutely. There's a constant presence.
It's an interesting name for what they do. They're violence interrupters.
Because they're actually interrupting the transmission of disease.
Okay, so
Are they able to? Is this a full-time job for them? then? Or-
Absolutely.
okay.
This is a full-time job with benefits.
Wow.
Absolutely.
well, I know you're going to try it again now after all these years in this district, the 14th. And you have funding for that one?
We have some funding to get us started. We recently received a grant from the Pennsylvania Commission on Crime and Delinquency, and we spent a year, we're almost coming to the first year end in terms of planning, and now we're in the process of hiring individuals for that
Thank
particular
God.
district,
Well, you know,
which
we
is in
want
Germantown.
it. We want it in all sorts of districts. So how do we get that? We have to go through Harrisburg for that kind of money?
Well, you know, there's certainly funding available in terms of Harrisburg. The Department of Justice recently put out a grant where
Yeah.
organizations here in Philadelphia could certainly apply.
And what about the city?
The city, you know, we have had, you know, discussions with the city about replication of the cure violence model. They partnered with us early on, so they are aware.
For the love of God,
They're aware, but
something-
they're not putting money in, I guess, or because it sounds like if they're not everywhere. If
Well,
this
the
isn't
city has
happening-
committed to their own projects right now, but
Okay.
I do think that they are open
Okay.
in terms of thinking about this particular model and others. It's not just the cure violence model that's been proven to be effective. There are other models as well.
But it seems like at this point we need all hands on deck, right? All models, all programs, whatever, you know, is showing results.
Absolutely, and all people. Everybody has to own this. It can't just be the city. It can't just be law enforcement. Everybody has to have ownership of this.
Thanks for the work you do.
Thank you.
It's
Thank you for having us.
You've been doing it 12 years or more.
Yes,
so appreciate
absolutely.
it.
And if people want to find out more or be a part of this, how can they learn more?
Sure, they can contact me directly, marladb@temple.edu, or they can call me at 215-806-8493.
And of course, we have the website on the screen there as well, and this will be put on our website.